The first point of call of members of the Health Committee of Parliament at the Upper West Regional Hospital was the emergency ward, where they interacted with some management members of the hospital led by the head of the medical department and physician specialist, Dr. Nabil Depe.
We are well equipped. Of course, we can always improve the situation. One of the things we probably would require a station here is an ultrasound scan machine. We have a number of ultrasound scan machines in the hospital, but at the moment we don't have one purposely for the emergency. And sometimes when patients come, you need an urgent ultrasound scan to make a diagnosis. The big challenge we have is doctors, the medical officers and nurses. Because, nurses at the emergency. Yes, nurses at the both those who are specifically trained as emergency nurses and the general nurses. Yes, so that's the challenge because we had to increase the numbers. So increasing the bed capacity here from 8 to 20 plus an additional 10. But we've not had a commensurate increase in number of nurses. So our nurses are stretched. So it's one of our challenges. And then the medical officers as well. So not too long ago, in the night, we had only one doctor on duty. And you can imagine what happens when you have multiple patients coming with emergency. So we've had to stretch ourselves. So currently we have 2 doctors running the night duty. And during the day, there are 3 doctors. But we are so stressed out. There's virtually no rest because every day, they have to be here. So, if we can be helped to increase the numbers, it will help significantly. One thing that I'll use the opportunity to appeal for is the posting of the medical officers to the region and the house officers. So currently we are in touch with the Medical and Dental Council to increase the number of posting we get to the first, because that helps build the numbers.
The issue of inadequate nurses at the medical department also came to the fore.
If we look at the nurses, we are just 20 nurses assigned here. And if we compare, we are currently doing 1 nurse is to 103 patients.
That's quite
and it's affecting us. So based on that, we also detected for the past 2 years, about 4 nurses from the ER developed cardiac conditions. 1 also at a medical ward. So if something can be done about it, so that more nurses will be assigned here to make the work go better.
Members of the health committee also made a whistle-stop visit at the hospital's laboratory, dialysis center, and the intensive care unit.
One thing we need here is the pediatric ventilators. So that is what we don't have. Yes, so but we keep managing pediatric patients because the pediatric department doesn't have its own ICU, so we manage them here. And sometimes we have to adjust the setting of the ventilators, and it's a bit of a struggle sometimes. So if we can get pediatric ventilators, it will help us a lot, because that one is something that we will need. Yes.
The lights go on quite often. So so the time a patient is on vent, lights will go off. It equally affects the oxygen flow, the central oxygen. The plant, when the lights go off, it's not stabilized, especially when a patient is on CPAP, the vent. It consumes much oxygen. So until the light is done, then the oxygen plant restored, then the vent to be stable.
Because of the electricity consumption, I think director and management have been on the neck of BRA and NEDCO to get us a dedicated power line. We've still not been able to secure that, so that it will reduce the power fluctuations and all that. Currently, our CT scan machine is down. Efforts have been made to fix it, and it's because of these power fluctuations.
They clamored the visit with a meeting with management and staff of the hospital. The members of the health committee poured laudations and encomiums on the management of the hospital for working to make the hospital not only clean, but ensures that equipment are maintained properly despite the challenges faced. Chairman of the health committee and deputy ranking member, Dr. Market Danwani and Dr. Bochi Yodon Patrick, respectively shared their thoughts on the visit.
And I believe that something positive will come out. Yes. We've seen the problems, The PCR machine is only one for a region that usually have an epidemic of meningitis. That is not enough. They need 1 or 2 of such machines to add so that they can manage their meningitis cases, from the standpoint of science. They are doing very well. And we want to will report that they can look at the possibility of converting it into another teaching hospital in the northern part of the country.
I say we commend the staff and the management for the wonderful work they are doing here. They are not only taking good care of the patients, but they are also taking good care of the facility around. I think the hospital is doing something well here that other facilities must come and learn from.
Reporting for Dway News, Rafik Salam. Wow.
The breakdown of life-saving equipment in major hospitals in the country remains a challenge to the country's healthcare delivery. Despite the situation being recurrent, successive governments appear to have done little to deal with the situation. Dr. Thomas Anaba believes it is about time a lasting solution is implemented to deal with the challenge.
Definitely we must take interest, because that is part of our work, to go around like we are doing, to see to it that what government intends to do in the hospital to keep people alive, give Ghanaians the needed health care, they do it. Once it is failing and our attention is drawn to it, we'll definitely try to go into it to see what the main problem is, who is at fault, or is it the system that is failing, and try to tweak it. Luckily, we know that now the NHIS has been uncapped. So more money now would go to the hospitals to ensure that they use it for their internal things and even procure. And after we make some recommendations to them, we'll see how equipments can be brought to hospitals. There are various ways to get equipments to hospitals.
The committee, as part of its mandate, visited the Ashanti Regional Hospital and the Komfo-Anokye Teaching Hospital in Kumasi. Lack of space and high attrition rates remain a worry for these facilities. The parliamentary committee, through deliberations with managers, proposed some solutions to address the challenges. Dr. Anaba is hopeful of an amicable resolution as he expresses confidence in the managers of the facilities.
We looked around, and actually this is one of the hospitals I have gone, and we didn't have a course to talk about hygiene. I think it is very exemplary. That of the Kumasi South too was same, and we think that other hospitals should emulate this. They have invested their own internally generated funds in renovating parts of the hospital, which is a very good thing that we should applaud them for. And we hope that they would, with this track record, anywhere they go to source funding, they will know that productivity will yield the needed dividend for them to pay back for whatever money they would like to use to buy any further equipment to improve upon the service.
Meanwhile, the committee is encouraging the facilities to consider expanding services offered to the public. For Joy News, Nanaya Ojima, Kumasi.
Welcome back, and on the back of that, we have an engagement coming your way as we delve into the health-related issues. You remember the Tamale Teaching Hospital? Well, here we are back with more action, not on that facility, but other developments. Dr. Mark Kurt Nawani joins the conversation. He is chairman of Parliament's Health Committee. Good morning, sir.
Good morning. Let me say good morning to the viewers of the Joy TV.
It's a pleasure having you join the conversation. What led to this, decision to go and get these sentiments from these health workers? Just want to know whether it had anything to do with the previous instance we just had at the Tamale Teaching Hospital.
No, the health committee had already planned about a month earlier to go on an outreach program, yes, to the regional and teaching hospitals. Yeah, we wanted to start with the regional and teaching hospitals because during the budget hearing, a lot of issues came up. And we thought that, no, by going to the grounds, we'll get a first-hand information about what is happening in these hospitals, and then we can advocate for them. Yes.
Okay, so this is not a, one-off situation. It's not a 9-day wonder. It's a program you have.
Exactly. Parliament has repositioned itself that the committees have to go out and gather information, interact with the ordinary people. In other words, people should start feeling the Parliament of Ghana at their doorstep. So you see that the sanitation committee went out The education committee, they were also about to go out, and so many other committees are on the move. Yes, want to get our clients, want to get the institutions and agents that we supervise to get personal information.
Dr. Nawani, my colleague Sweetie Abachi will come in shortly. Just a quick one, though. So which entities in the next few weeks or in the coming days are you targeting next? And what would be your brief takeaways from this last interaction with the medical professionals?
Come again.
Okay, so let's start with one. Which other entities, medical facilities, are you targeting after this one?
Oh, after this one, we will be targeting the district hospitals, some of them, and we can also target the training institutions, the nursing training colleges that are under the ministry.
Okay.
We hope, we should be able to get a first-hand information about the problems that they have.
All right. So these this last group you interacted with, I heard a lot of things they said, but I just want to find out from you before Sweetie comes in, what were the major things that stuck with you on the back of that interaction?
The first and foremost is the lack of adequate staff. In all places, they were complaining of the lack of staff. And now looking at the situation, we have a lot of trained staff actually waiting for financial clearance. And I want to advocate that, yes, as a nation, if we cannot give financial clearance to everybody, we should do some form of differential aspect of giving this financial clearance. In other words, if you go to the whole of Upper East and Border Hospital, to be specific, there's one radiographer. The whole of Upper East Regional Hospital, there's one radiographer who's supposed to man the X-ray machine, the CT scan, and if there's going to be an MRI, he's supposed to be trained to be able to do it. That is simply not enough. One person managing a regional hospital in that aspect, and one gynecologist also at post. So we should give financial clearance to some people. We should just choose that hospital, give financial clearance to people to go there and work. That's what I mean by being selective in giving out our financial clearances to solve some specific problems. We should be able to do that instead of waiting to give a wholesale financial clearance, which we cannot do. And if you go to the Baptist Hospital, being the regional hospital of the upper and northeast region, only 4 doctors are taking care of over 100 outpatient people within a year. I just ask myself, how can this happen in this century of ours?
Right. And Dr. Nawani, I mean, this strategy, while it's commendable, I'm concerned that perhaps it may not be sustainable because of that altercation that ensued at Tamale Teaching Hospital. Many hospitals now know that you may pay them a surprise visit and they will put their houses in order before you arrive there. Are you concerned that that defeats the intention behind the strategy?
Our visit was not a surprise visit, honestly.
Oh.
And the committee's visit was not a surprise visit. The committee, we wrote to the CEOs. They were aware. I spoke with each of the CEOs, apart from Kuoto, where I couldn't get a CEO. All the hospitals, 10 or 12 hospitals that we visited, I spoke to them personally and made them relax because I've got a lot of experience running hospitals, 32 years of medical practice. You don't need to prepare and wait for me. And the problems we'll identify, whether you prepare or not, we'll be able to do that Yes, because we go to departments and we see that there are only 3 nurses over there, and we ask why is it that on this shift with about 40 patients, like in the Baptist hospital, you have only 2 or 3 nurses in the afternoon shift. And then we will be able to know that, no, there's shortage of staff. And of course, there's crowding over there, and they have uncompleted structures. And so we can demand to know why the uncompleted structures are so uncompleted and what we can do about it. In principle, we want to have the institutions solve their problems and not necessarily to go there trying to find fault with them. No. I have practiced in the system. I know the limitations, and I understand what they can do and what they cannot do. Yes.
So, I mean, again, that strategy is commendable. But is there no other way that these hospitals can table their challenges without Parliament, Health Committee going into the hospitals on the ground to find, these issues for themselves?
Yes, there's a way, because there's an annual reporting of what is happening at the hospitals. But when a lot is not being done, and when you have to prioritize, you have to select, then you have to probably go to the front and know. In a situation where we had enough money to just bring in whatever the hospitals request for, we might not need to do this. But obviously, we are limited in terms of resources. So we need to go there and understand.
Okay,
and also understand why they are not able to, let's say, repair their own machine. Their IGF, the internal generated fund, what is happening to it? Why is it that when they are using machines and they break down, they have to inform the minister to come and repair it? You are using a machine. You are being paid for the usage of the machine. Then when it breaks down, you now call the minister to come and repair it. And so we have to advise them what to do to probably escrow some money or fence wall some money and put down, say that when the machine breaks down, you use the money to repair. This is what we have to go there and share our ideas with them. And with the experience of the committee, the committee has got human resource, we have got health entrepreneurs, we have got insurance people there, we have got medical practitioners of different categories. Yes. And when we go there, with this, our experience, we're able to share with them on the ground and let them know that, no, they have to up their game.
Dr. Nawani, you're saying that the existing systems where hospitals table their challenges or assess the efficiency of these hospitals is not churning out the desired results. So what's the strategy to smoothen out the inefficiency so that it can be sustained without members of parliament going to, I don't know how many times you can go to hospitals within a year or, this under this administration. What is the strategy to ensure that you're leaving behind systems that will work without members of parliament going into the hospitals to do an assessment of their challenges and whether or not they're being efficient?
Members of parliament have to continue to do their work and make sure that we keep an eye on these hospitals. I'm saying this because, well, there's an accountant general, and yet we appoint an auditor general. And that is to make sure that the accountant general does his work. So we, members of parliament, have to continue to keep our eyes and ears on the ground and ensure the hospitals and the facilities, they are able to provide services, quality, qualified, and specialized healthcare to the people of Ghana.
Dr. Nawani, are you saying this strategy is sustainable, that for the next decade, perhaps, members of parliament, should I say members of the health committee of parliament, will be going into hospitals to do an assessment of the challenges and whether or not they're being efficient as a way of monitoring?
Yeah, all the agencies under the Ministry of Health need to monitor. In other words, we should not leave this work alone to the executive arm of government. We meet them at budgetary hearings, and when we pick up that there are issues, we really need to take action. And one of the actions that we can take is to go to the ground and listen to them.
Ben.
One of the issues I heard them talk about, and I know there are budgetary constraints when it comes to employment of doctors, nurses, and the rest, but they seemed to suggest that there were staffing challenges. 2 doctors operating at night, 3 during the day, and all of that. Did you get the sense that this was not enough, especially as they were talking about how tired some of them became and some even succumbing to cardiac-related issues? What is your take from that?
Yes, it's unfortunate. And I think that as a nation, we need to prioritize a lot of action. If you go to Kolebu and Kovanochi and the rest, of course, they are training doctors. But it appears that some of doctors, they are far above that of some of these hospitals. Baptist Hospital, for example, with their 4 doctors, I believe that they stand a chance of being falling sick. That means that practically all of them can be woken up in the night, and so they can't get enough sleep. They'll be stressed the next day, and still they have to work at the outpatient department.
What would be the general plan going forward to increase the numbers? We also know that for nurses, for example, there's quite a backlog, and oftentimes there are nurses who don't get placement, and some of them eventually end up, fleeing the country to seek greener pastures. What is the plan eventually to get some of these health professionals to plug the holes in the system as we see it?
Well, like I'm saying, when you ask for project around, it's related to ability to pay. And so I'm so calling on the government that they should, in a discriminatory way, give for that some staff go to company. And gradually, because let's say this is enough system. There are so many doctors who are sit down not working. If only they can be posted to this hospital, I believe that the situation that we found ourselves will be at the end of the past. However, let me also mention something that I observed, and that is the attrition rate of health professionals from some hospitals. Yes, that is, they are posted there, they spend 1 year, 2 years, they disappear. And so I'm saying that this situation can only be solved not only by government, but by some form of motivation at the hospital level. And that is why we should be interested in their ideas, so that they can, part of it can be used in some form of motivation for their staff. Indeed, I'm calling on the Minister of Health and the ministry to be interested in the IDF of this hospital. Compare them. Just look, you don't need to give them any pressure, but compare the statistics with their incomes that they are declaring, and from one hospital to the other. If they say that the patients have come in, ask of the bad debt that they declare, whether because the patient has gone, You are supposed to declare that as a budget. And how many hospitals, when they are reporting to us at budget level, declare a budget? And there's a procedure for that. So we can't just have these hospitals having a lot of assets and they don't have anything to show for it. And the National Health Insurance Authority, they need to up the tariffs. The tariffs are woefully inadequate for the operations of the hospitals. We need to do something about it. Decrease the amount spent by the bureaucracy and spend more on claims. The 58% and 50% that they spend on claims is not enough. They have to probably increase it to 75%. And I believe when they do that, these hospitals will have enough money to stem the tide of staff attrition and also carry out maintenance in their hospitals.
That point is important, the one you make, incentivizing the work they do and IGFs and all of that. But how about also cracking the whip? Because if these people are trained with government subsidies, they are supposed to stay, they are bonded to stay in the country for a certain period and they don't stay. What are the consequences for them? If there are no consequences, this will continue, won't it?
Let's me be honest with you. Whether they are bonded or not bonded, they will still find a way of ensuring that their freedom of movement is not restricted. There was a time when they bonded nurses and all those type of things. But if for somebody and the person competes, employ him or her, that's really you are both you can't to the cat, but you are not employing the person. What do you want that person to do? So that is the reality that we need to understand. Man must live.
All right.
Well, Dr. Market Nawani there, Chairman of Parliament's Health Committee. Thank you for spending some time with us this morning. So that's that for this conversation. Hopefully we have some time to pick your calls when we return from this break. Please stay.